Did you know that piriformis syndrome can mimic sciatica and it can affect millions of people over their lifetime? Today, we're going to explore the 7 best stretches and exercises to do if you're suffering with piriformis syndrome. And perhaps most importantly, discuss the most controversial stretch regarding piriformis syndrome and why there's so much controversy around it. But first, let's start with understanding the difference between piriformis syndrome and sciatica, because that actually lends itself to why certain stretches may be good or bad depending on what you're suffering from. I am not somebody who actually believes that any stretch is good or bad. However, it could be the wrong thing to do for your symptoms right now. So it's important to understand what it is you're actually suffering from so that you can then find the appropriate stretches and exercises for you. Piriformis syndrome versus sciatica. This is a really difficult question for many people to answer because they don't understand what's the difference between sciatica and piriformis syndrome. All right, so let's clear that up first. The first thing is that the piriformis is a muscle that starts at the sacrum and attaches onto the femur or the leg bone. Now, the sacrum is the heart-shaped bone that sits in the middle of your low back at the base of your spine. So it travels deep to your glutes, and it's a thin, strappy type muscle. If you feel like you have some tension, like really deep in your buttocks, chances are good that it's because your piriformis is tight. Piriformis syndrome is a muscle tension issue. This is different than sciatica, which is a nerve issue. Now, sciatica is formed from the nerve roots of L4 to S2. Those occur in your lumbar spine and then in that sacrum that sits in the bottom. They all come together and they form the sciatic nerve, which travels through your low back, down through your glutes, down the back of your leg, and then goes into your calf. Most commonly with a sciatic type pain, you're going to have a sharp shooting type pain, although some people will have a deep achy pain that goes all the way along that path. Most commonly with sciatica, you will have specific motions that increase your pain, as well as some things that you can do to decrease pain. And in general, this is the difference with piriformis syndrome. With piriformis syndrome, you usually will have that deep, achy pain. Now, it might get a little bit better when you do activity because the muscle gets some blood flow and it calms down and relaxes a little bit, but that deep, achy, tensiony, tight pain is always there because it's a muscle pain. Muscle pain is different than nerve pain. Why do so many people get confused if they're suffering with piriformis syndrome or if they're suffering with sciatica? Here's the thing, friends. The sciatic nerve actually travels near the piriformis. Now, it can go underneath the piriformis, it can go on top of the piriformis, and it can go through the piriformis. And it's about an even split between the three. So it's hard to know which one that you actually have. And when that muscle gets tight, it puts pressure on the sciatic nerve, which can cause sciatica type symptoms. So you may have a diagnosis of sciatica, but the root cause of it is piriformis syndrome. Now, I would further question what is the root cause of your piriformis syndrome, but that is not what we're talking about today. Why is it important to understand if what you're suffering from is a true sciatica versus a piriformis syndrome? Which one is the primary one that's causing your pain? It is super important because the exercises I recommend are extremely different, especially the first exercise we're going to do. The first exercise is going to be one that I do not recommend doing if you have sciatica. It puts pressure on the nerve, it compresses it more, and it's going to make it angry. And you may think, oh, it makes it feel better at first, and it may make it feel better at first, but that's not what's going to happen long term. You're going to end up irritating it and causing more problems. Whereas if your primary problem is a piriformis syndrome, the first stretch will help to relieve some of your symptoms and make you feel a little bit better so that you're able to move more and get more blood flow to that muscle to help it relax and decrease its tension. So that's why it's really important to understand if you have sciatica versus if you have piriformis syndrome. If you are suffering with sciatica, I'm going to recommend you check out this video over here for some exercises that are safe for you. And I'm going to ask you not to do the exercises that I'm recommending today. But if you're suffering with piriformis syndrome, you are in the right place because these exercises are going to get you feeling better quicker. All right, the first stretch that we're gonna do is the figure 4 stretch. Now, when you're doing this, there's different gradients you can do. I'm gonna ask you that when you do it, you make sure you find what feels like a good stretch to you. More is not necessarily better. Think about this fact. If you have a tight muscle, what's happening is all those muscle fibers are staying in that contracted state. So if you try to pull on them very hard and aggressively, they're not going to be very happy about it, and they're probably going to complain, which is not going to leave you feeling better, which is the hope in the first place. So find the level where you feel a good stretch, as in it feels slightly uncomfortable, but in a good way, as opposed to going for the full expression of it and ending up in pain, turning red, huffing and puffing, and feeling like this crazy lady doesn't know what she's talking about. So to do the figure 4 stretch, you want to find somewhere you can lay comfortably on your back with your knees bent up and your feet flat to start with. You're going to take one ankle and you're going to put it up on top of your knee. And then if that's enough of a stretch, that's where you're going to stop. If you need more of a stretch, you can push that knee away from your body. This will help to increase the stretch in the hip. Now, if you're doing this and you still do not feel any stretch along the outside of your hip right here, then what I'm going to have you do is bring that other leg to your chest and hold it with your hands. And this will be your full expression of the stretch. Find the position that is a comfortable stretch for you, hold it for 10 seconds, and then do it on the other side. I always recommend when we're doing the piriformis stretch that we do both sides, because one side may be painful, but the other side might be tight. The next stretch we're gonna do is a hamstring stretch. Now, if you're just starting to stretch, then I recommend using a strap in order to stretch your hamstrings. I'll include a link to this one below. I feel like it works really well because it's got the different little holes in it. What you're gonna do is you're gonna put one of the little holes around your foot, and then you're gonna hold on down here in these holes. Then you're gonna straighten your leg, and you wanna start with a nice straight leg. I don't like to bring the knee to the chest and then straighten up because then it's harder that way. It puts more strain on the hamstring. I like to come all the way straight and then use my hands to pull back. Now you can see right now my hamstrings are super tight because I've been training for the dopey, and so I need to be doing this stretch multiple times per day. But what you want to do is hold this stretch for 10 seconds. If you feel like you can increase the stretch a little bit, you can pull it towards you during that 10 seconds. But after 10 seconds, you want to give yourself a rest, switch feet, and do the other side. So the next stretch we're going to do is the quad stretch. So again, I like my loopy band for this, and I like doing this one laying on your stomach because then you have that good support through your spine. You're going to loop it around your foot, and then you're going to bring that foot towards your body. Again, you're going to hold for 10 seconds, and I recommend doing both sides, although this one's a little bit more difficult to get into. So if you want to do 10 seconds and then rest for 10 seconds, just let it go. Let that foot hang out a little bit, move it around for 10 seconds, and then you want to go back into it. That's fine. You don't have to do each side in between because this one's a little bit more complicated to get into, but you should be feeling a stretch along the front of your thigh with the quad stretch. Now the next stretch is one of my favorite stretches, and that is the psoas stretch. So we stretch the front of the thigh with the quad stretch. Now we're going to get the front of the hip. So with this one, you need to be laying on a surface where your foot can rest on the ground. Now, to be fair, this one's a little bit low for me because I'm not feeling a stretch in the anterior hip here. If that's the case for you, then you're just going to sneak this foot back so that you can drop that knee down further. Now, when I do this, I also feel that stretch through that anterior hip as well as the front of the thigh. So you get a little bit of quad as well as getting a little bit of psoas. I recommend with this stretch keeping the other knee bent up because that makes sure that your low back is supported. If I put this leg down and walk that knee back, I don't know if you can see, but my back starts arching up a little bit. I prefer to have that knee bent, keeps my lumbar spine stable, and then I can just really stretch that psoas in the front of the hip. Again, you're going to hold this for 10 seconds. Since this position, again, is a little bit harder to get into, I usually recommend that people just rest with their knees together for 10 seconds before going into this stretch again. And of course, when you're done, you want to flip over to the other side to make sure that you stretch the other one. So we're going to come to one more stretch at the end of this video. but we're going to do that one in standing. So we're going to complete all the ones that we're doing laying down, and then we'll stand up and do that last stretch. So now we're going to move on to the exercises. And I always recommend for people who are suffering with piriformis syndrome, after they finish their stretching, that they do some exercises to help bring some vascularity or some blood flow to that muscle. And the best exercise for that I know of is the clamshells. So what you're going to do is you're going to lay down on your side with your hips stacked on top of each other. Now I'm holding my head up here, but you could do it with your head resting down. You don't have to hold your head up. But your hips need to be stacked on top of each other and your feet are stacked on top of each other down here. Now keeping your feet stacked and your hips stacked, that's the hard part. You're going to lift your knee up as far as you can and then bring it back down. Now the key thing is that my hips are staying stacked here, so when I get up to that end range, I can really feel that piriformis tightening and contracting through here. The thing is, a lot of people, when they do clamshells, they'll try to get it up as high as they can, and you can see how my hip is opening up here, and that's working more my leg muscles because more of my leg is doing that activity, as opposed to really getting into that piriformis. Keep those hips stacked, open up that knee as far as you can. Now remember, the goal with this exercise is to get some blood flow to that muscle. So our goal with this one is to be able to do 2 sets of 20 on each side. However, for some people, 20 may be too much to start with because that may actually cause them to lose their form, or it may cause that muscle to actually tighten up because it's struggling to perform that exercise. So I say do as many as you can with good form. Don't worry as much about the number. Just understand that the goal is 20. So when you can do 2 sets of 20 on both sides, and it's pretty easy to do that, then you're ready to move on to a different exercise. So now the next exercise is not particularly for the piriformis in general, but it is for a muscle that tends to go into dysfunction when the piriformis is in dysfunction. And that is the gluteus medius, which is this muscle right up here on the very top of your hip. It's the muscle that attaches into the IT band, which, side note, is the one we're going to stretch next. In order to work the gluteus medius, you want to keep your hips stacked, just like they were for the clamshells. You're going to straighten that top leg. You got to be really careful with this one because what happens is that some people will try to straighten that leg and then they'll end up rolling that hip back, okay? Really important to keep that hip stacked on top of each other. Then you're going to lift that leg up as far as you can and back down. Now, a lot of people ask me when they're doing this exercise, what position should my foot be in? Should it be pointed? Should it be flexed? I'll tell you, it doesn't really matter for the exercise. It's really what feels the most comfortable for you. Now, right now, I'm doing a ton of running because I'm training for the Dopey. And I find that when I do this exercise, I really like to have my foot flexed because I feel like I get a little bit of an extra stretch while I'm doing that. But if you feel better doing it with your foot pointed, I am not concerned. Do what feels best for your body. Again, the goal with this is 2 sets of 20, but do what feels best for your body. Do what feels like you get good blood flow to that muscle because that's what we're trying to work on right now. And just make sure you're listening to what your body wants. When you can do 2 sets of 20 on both sides without any difficulty, you're ready to progress on to another exercise. Okay, so now we come to the always controversial IT band stretch. Now, can you actually stretch your IT band? No, because it's a thick piece of fascia and it doesn't actually stretch. What we can stretch is that gluteus medius, that muscle that we just worked on the side of the hip. And since we just worked it, it's going to be easier to stretch it. But it is important to keep that mobile and will affect how your IT band is functioning. And we all know that the IT band likes to go into dysfunction whenever anybody else is having a problem in the hip, so we want to make sure to work on that too. So my favorite IT band stretch is to take one leg, you're going to cross the other leg over, so basically at the knee, and I pull my shirt back here, all right, and then you're going to stick your hip out to the side and a little bit back. Now, if you're like, I'm not really feeling it there, play with it. For some people, they'll feel more of it when they're out to the side. For more people, it's a little bit back, and it can vary from day to day, but you're going in a diagonal pattern as if I'm going back towards that hip. So finding that spot where you feel that good stretch, There's mine. And I can feel it through the side of my hip. Now I can feel something happening through my IT band. It's actually not stretching, but it's pulling on that quad and hamstring. So it's gonna help it feel better. Again, you wanna hold this for 10 seconds. Now with this one, since it's usually pretty easy to get into, I'll go ahead and switch sides and realizing that it can be different from side to side. So for me on this one, my right side feels a lot different than my left side, but my right side's a little bit irritated right now anyway, so that makes sense with what I'm going through. So don't worry if there's a difference side to side. We all are special and we all have differences. Do what feels good for your body today. Alrighty, friends, so there it is, my 7 favorite stretches and exercises if you're suffering from piriformis syndrome. Now again, if you have made it this far and you still are not sure if you're suffering from piriformis syndrome or sciatica, I'm going to recommend you check out this video here. And I would love for you to drop a comment below and tell us what has been helpful for you with your piriformis syndrome. Please boop that like button because that helps the algorithm, and don't forget to subscribe, friends.